So welcome everybody. Thanks for coming. I'm Dr. Cliff Smyth. I'm a faculty member in the College of Integrative Medicine and Health Sciences at Saybrook University in the Department of Mind Body Medicine. And on the screen is the rose quartz crystal heartstone that I use in my mind body spirit integration groups. And we'll be doing a heart-centered meditation today. So let's begin. Let's sit comfortably in a way that you feel supported, inviting the floor and the chair to support your body, and inviting a sense of the rising up of the spine from the pelvis, imagining and sensing the spine long. Imagining, sensing the spine long, the head supported, and making any and all of those little adjustments you need to make to feel more supported, to be more comfortable, to feel more dignified. And dropping in on a sense of the breathing in the body, and particularly the movements of the ribs and the abdomen. And just now taking 3 deepening breaths, 3 slightly larger breaths without any strain, and allowing the ribs as much as possible to soften, to expand a little more forward, a little more sideways, a little more backward. Softening the abdomen and expanding the chest softly, and then breathing out slowly, softly, a little longer than usual. Maybe letting your teeth and lips separate so the air can leave the body softly. And now staying with that invitation for gentle exhale, for the exhale to gently lengthen a little bit. And feel if it's possible to invite a sense of letting go. A gentle sense of letting go with each out breath. And can you also find a sense that you don't have to work so hard to breathing, so much to breathing. The ribs widen and spring open that little bit spontaneously in response to the out breath. The diaphragm contracts and draws the lungs down gently and spontaneously with each in-breath. Attending to the out-breath now with a sense of easing, of letting go. If it's possible, inviting that sense of softening and lengthening of the out-breath. And as you breathe in, just allow it to happen. And bring your attention now to the center of your chest, somewhere in the middle of the chest, behind the breastbone, the area where the heart is beating. Take a few breaths now, imagining that you could breathe into that area without any additional effort into the middle of the chest, behind the breastbone. Imagine that you could breathe into this area of the heart, into your heart space. And if it's comfortable, bring one hand or both hands to the middle of your chest. You can rest your hand or hands anytime you want to, of course, and sensing with your hand the movement of the breathing in that area, in the breastbone, in the ribs. And imagine that you could breathe a little more softly into that heart space. Noticing, of course, if the breathing changes, as it might with the attention there or your changing needs for oxygen. Sometimes there's a deeper breath in, sometimes there's a sense of sigh as we breathe out, inviting what comes with your breathing. And maybe there's a sense of warming there at the center of the chest, where you're resting your hand or hands, if that's comfortable. And take a moment now, however you conceive of it, to direct a sense of care toward yourself, inviting or invoking feelings of compassion, care, the desire for calm and well-being, using this soft touch, like the caring touch that you would use with a loved one, to direct this care into the area of the heart space. Staying with this sense of breathing into the center of your chest, into the heart space, and these feelings of self-care. Resting your hand or hands anytime you want to, and sending yourself care and compassion into and through the heart space. And staying with this sense of breathing into the center of the chest, into the heart space, into and through the heart space, sending these feelings of self-care. And reflecting for a moment now, meditating in that other sense of meditation about the many meanings of heart. Rest your hand anytime you want to. There is the heart that is the pump, moving the blood to the lungs to be nourished with oxygen, and then moving the oxygenated blood around the body. The heart that can send hormones where we need them, and whenever a demand comes up, rapidly to every part of the body, if needs be, within 1 or 2 beats. Then there's the meaning of the heart that is the center of things, the heart of the matter. In French, there is the cour, the courtyard in an apartment building or a neighborhood where life goes on and can be observed. The heart is a space where we can sense the comings and goings of our life. And then there is the heart that's the home of our emotional life, which we've known since the ancients, and now we know from research that the slowing of the breath causes a neurological resonance. Slow, regular breathing sets off a coherence in the healthy variability of our heartbeats, a cadence that stimulates positive emotions and a sense of connection with others. And finally, there's the heart of courage, from the Latin cormium, the courage to take that next breath, to take that next action. The courage to show care to yourself and to others, even in the most difficult of times. And returning again to that sense of breathing into and around the area of the heart, creating the space and the comfort and the ease that's needed now for the heart to beat comfortably, whatever's available for you right now. You can keep your hand in the center of your chest or rest at any time. Continue to breathe softly and continue that sense of letting go, that gentle lengthening of the out-breath without any work, knowing that the next breath will come, and it does. Bathing the area of the heart, bathing it with care, bathing it with this sense of breath into the heart space. Breathing into the heart space, directing those feelings of care and compassion into and through the heart space, to yourself, and through your day. Your breathing and the beating of your heart will be there for you. And slowly now, very slowly, resting your hand and arms if you haven't till now. And dropping back in again, feeling back in again into the sense of the breathing in the chest and the abdomen, all around. The breathing in the body and the body itself sitting there, standing there, lying there. Directing your attention to the whole body, and then allowing your attention to go out to be aware of the room that you're in. If you let your eyes closed or your gaze soften, slowly letting your eyes open and reorienting to the space, reorienting to your day, making any little movements that are also compassionate and you want or need to make. And in a minute, you can slowly rejoin our circle here in this virtual place that we share. Thanks everyone. Take care and be safe.